Good day, my esteemed professional colleagues and member of the society. I firmly welcome you all to another impactful, reminiscence and felicitative event titled International Nurses Week, alongside your preferred nurse, Dahiru Ahmad, with a worthfull piece named Nursing and the Society. Nursing and the Society. Now, introduction. On my introductory part, here is nurses advocate for health promotion, educate patients and the public on the prevention of illnesses and injury, and they also provide care and assist in cure, participate in rehabilitation, and provide support. No other healthcare professional has such a broad and far-reaching roles than nurses. Nurses do more than care for individuals. They have always been at the forefront of change in healthcare and public health. Society should consider the great roles and selfless services rendered to them by nurses at due cost. This is a nurse for you. Now, on my next heading is what nursing is all about. On this our Nurses Week, I will inform the member of society and inform you all on what nursing is all about. On this my subheading, according to Virginia Henderson, define nursing as the unique function of a nurse is to assist individual, sick or well, in the performance of those activities contributing to his health or its recovery or to a peaceful death, that he will perform unaided if he had the necessary strength, will or knowledge, and to do this in such a way as to help him gain independence as rapidly as possible. Virginia Henderson is also considered as the as a founder of modern nursing about from Nightingale. So this her definition is still teaching us that what is teaching us in essence is that it is among the major responsibility of a nurse to make sure he care for someone, care for his patient, being him sick or not sick. So if the patient is sick, the nurse will perform a variety of care treatment to him to see that he recover from his illness. And if the patient is not sick, the nurse may advise him, guide him, and offer counseling services. And those things that the nurse will offer to his patient will aim at improving the individual health. This is one of the content of the definition. And the definition goes by saying, not only that, nurses may ensure the patient have a peaceful death. So if patient is going to die, a nurse will make sure that his patient is undergoing a peaceful death. This can be achieved by through relieving the patient's pain, and also if the patient want to pass a will to one of his closest one, the nurse make sure that he assists in getting that patient so as the patient will pass his appropriate will to the patient, alleviating the patient's pain like emotional pain and physical pain, administering oxygen to the patient when he is at the stake, and to tell you that all those activities that the nurse will offer to his or her patient required knowledge. The nurse must possess knowledge, reason why he's doing those activities. Not only that, the skills, techniques to perform those activities, and the strength to make sure that he has the necessary energy to perform those activities to the patient so as to make sure that the patient recover and resume his activities of daily living as quickly as possible. Now, in knowing what nursing is all about, I will quickly go on to the definition of nursing according to Florence Nightingale. Florence Nightingale is considered as the mother of scientific nursing. So, Florence Nightingale defined nursing as the act of utilizing the environment of the patient to assist him in his or her recovery. So, Nightingale considered a clean, well-ventilated and quiet environment essential for recovery. She mostly emphasized on individual hygiene, clean environments, good water, fresh air, good nutrition as a powerful tool in curing the patient problem. So she believed that all these things put into consideration, put into practice, it will also provide a quickly healing method to the patient. That is, nature heals. What she believes is that nature heals, not only by giving patient medication, but through performing all these health promotive behaviors may ensure the health and well-being of a person. Now, my next heading is who is a nurse? Who the nurse is? Who is a nurse? A nurse is a person who has graduated from a nursing program and met the requirements outlined by a country, state, province or similar government authorized licensed body to obtain a nursing license. So a nurse here is someone who undergoes a certain practice program, sat and passed his final qualifying examination, registered and licensed to practice as a nurse according to the protocols of his country. So here on this our Nurses Week, I want to inform you that anyone who graduated from a non-accredited institution is termed as a quack. Not all those who wore white uniform are nurses. So I'm hereby pleading on our society to say no to quackery. Nurses are unique. Now, what are the qualities nursing care? What are the quality nursing care that a nurse performs, being it at the hospital, nursing home, geriatric home, orphanage home, and the rest? Number one, they make sure that they provide a holistic approach to physical, mental, and emotional needs, patient-centered and continuous care. So the patient is considered, both his emotional and physical care is considered by a nurse. Then number two, efficiency and effectiveness combined with humanity and compassion. So a nurse will provide that care to the patient effectively, efficiently, with a sense of humanity, humor, compassion to perform those practices. The third one is professional, higher quality evidence-based practice. Not only providing skills to provide care to the patient, a nurse may make sure that he has the reason why professional reason why he's doing such work for you. So you are at a safer hand by when you are handled by a nurse at the hospital, because he may know the reason why he's doing such things for you. There is a theoretical base on the reason why he's making some certain intervention for you. The fourth one is safe, effective, and prompt nursing intervention. Whenever you go to the hospital, you find out that nurses are at the front line that quickly intervenes to their patient whenever they are being brought to the hospital, despite the burden, despite the increased rise in number of the patient. But then a single nurse will make sure that he attends to the whole patient as quickly as possible, so as to make a quick and intervene to the needs of the patient. Then five is patient empowerment, support and advocacy. A nurse will empower patient, will support him, will advocate for him, will teach him, and the rest. The sixth is seamless care through effective teamwork with other professionals. It's only in the nurse at the hospital that will perform his duty, his own duty to you as a patient, and also extend hand to seek collaboration to other health professionals, so as you as a nurse make sure that you achieve the highest needs that you require as a patient. You may collaborate with pharmacists. When you need doctor's attention quickly, a nurse will send to that. When you need to set some laboratory investigation, a nurse will quickly make sure that you obtain those investigations. Is only a nurse at the healthcare setting that will ensure all these things about from his duty. So let's respect and show our gratitude to our heroes on this their giant effort. The next one is roles and function of a nurse and why nurses make the difference. Roles or duties, function and functions of a nurse and why nurses make the difference. Number one is caregiver. Nurses provide a care and assist a client physically, psychologically, and preserve the patient client's dignity. So when a nurse is providing care to you at a hospital, you consider your physical care, your mental care, and your dignity, your sense of humor. Are you imam? Are you pastor? Are you a nurse? Will give you your self-respect that you require as an individual. And the nurse, when providing a care, he provides a care to complete independent patient. There is a patient that cannot do things on his own. Partial care to the partial independent patient. There is patient who can do some things and cannot do things. And also supportive education care to assist clients in attaining his highest possible level of health and wellness. So this is a nurse as a healthcare giver. Why nurse make the difference is that nurse as a communicator. Nurse communicate Nurse communicate with all integral roles in nursing. Nurses communicate with other clients, support patients, other health professionals, and people in the community. So in this role of a nurse as a communicator, identify client problem and then communicate this verbally or in written to other members of the healthcare team. So it's a nurse that will make sure that he provide a good mutual understanding between you and him, so that you will be very often to him, you tell him your problem, then the nurse will communicate all those required needs that you need to perform as a patient, the part that you need to play. Is it an order from a doctor? Is it an order from the nurse? Is it an order from the pharmacist? A nurse may communicate effectively to you because he is the person who sat in contact with you throughout your period of hospitalization. The nurse as a teacher, nurses make another difference by serving as a teachers. So the nurse as a teacher helps their clients to learn about their health and the healthcare procedures they need to perform to restore and maintain their health. Nurses also assess the client learning needs and readiness to learn self-learning goals in conjunction with the client, enact teaching strategies and measures of learning. So nurse as a teacher, nurse will teach you all the required knowledge you need to know on the procedure or on the care that he is giving to you as a nurse. And also he will assess the level of your understanding so that you know the way to teach you on several things that you need to know as one of your rights as a patient that you need to know within the hospital. So it's a nurse that will formulate these strategies of teaching based on your level of literacy so as to have a good compliance to your treatment between you and him. Then nurse as a client advocate. Nurse as a client advocate protect the client. In this role, a nurse may represent the client needs and wishes to other health professionals, such as relaying the client request for information to the healthcare providers. So it's a client that will advocate for you. It's a nurse that will advocate for you. Nurse will serve as your voice within the hospital. If you have a problem, it's a nurse that you communicate to him. Whenever you have a problem, be it mild fever, abdominal pain, headache, back pain, anything that you need to know, you want to urinate, everything that you need to do as a patient is knows that a patient will channel those his complaint to him. Can you imagine how burden all these are? No matter how the minor or the major complaint is, it's a nurse that the patient channels the complaint to him. Then when those things are not of nurse's duty and he is the one responsible to advocate it to other health professionals so as to come and attend your need as quick as possible. Then nurse as a counselor offer this in helping the client to recognize and cope with stressful psychological or social problems to develop, improve interpersonal relationship and promote personal growth. So nurse as a counselor, nurse will teach you, will guide you to know to know your emotional problem and way to overcome those problems, to know your weaknesses and way to overcome those weaknesses, and also provide a good relationship between you and him within the healthcare sector. So these are among the roles and function of a nurse. My next title and the next heading here is title of a nurse and how he or she can be addressed. This is my next heading, title of a nurse and how he or she can be addressed. So person who graduated from an accredited nursing institution and the certificate in nursing can be referred to as registered nurse, that is RN in abbreviation, and those can be addressed as nurse, that is an abbreviation, that is NR or NUR. So this is an accepted title that you need to offer to a nurse within either in the hospital, at the roadside, at the home, at any way. If you want to allocate a professional title to him, call him RN, that is registered nurse, or address him as Nurse Ahmad, Nurse Ibrahim, and the rest. Allocating any title to a nurse other than this is unethical and unprofessional. So it is wrongly to be addressing nurse with titles like OC, Chief, Doctor, Senior Nurse, Junior Nurse, Matron, etc. It's a wrong act, it's a wrong behavior to be calling a nurse as OC or Chief or Senior Nurse, nothing like Junior Nurse within the healthcare setting. The only acceptable title is Nurse or RN. So I'm hereby calling on the attention of our society members to shun away those unacceptable titles. Thank you for staying with me. You can quickly click on the subscribe and like to this YouTube channel. And I also firmly congratulate and welcome you all on this grateful event, Nurses Week, starting from 6th May to 12th May. Thank you all. I remain humble always, Nurse Ahmad.